Hello and welcome to the award-winning Waterman Wellness. Your pathway to health and wellness with local experts as your guides. I'm Alyssa Hritzik. We have a lot of health news you can use in this month's episode, including you'll learn how you can help emergency teams save precious time if you or a loved one has a medical emergency. A local team of caregivers who help patients in their homes are getting high marks. We'll explain. And we share a new meaning for the word fast. It could help save someone's life. First, the number of cancer survivors living in the U.S. rose by 1 million over the last couple years. Experts credit research that led to new and better ways to prevent, detect, diagnose, treat, and cure some of the many diseases we call cancer. More than 100,000 clinical trials are currently going on in the U.S. Local cancer specialists say Lake County residents are part of the important research.
We are proud in our practice with Florida Cancer Specialists to say that we had patients that participated in clinical trials that approved at least more than 50% of the drugs that have been approved in treating cancer in the last 10 years, if not even more. So now we know these drugs work, they're in the market, but now we're trying to find an important protein or a step in the cancer cell that is very important for this cancer cell to help it grow. And if we can block that protein or stop this step from happening, then we can kill the cancer cells. So that's what we're aiming at, what we call personalized care. The other thing in managing or treating cancer is to enhance the immune system of the patient. So instead of killing the cancer cell, let's train the immune system to kill the cancer cells. Because we know that cancer cells are very sneaky, and there are drugs that have been approved, for instance, in melanoma. These drugs have been studied in lung cancer, kidney cancer, many other cancers that can help in enhancing the immune system. I'm the principal investigator for our lung cancer trials in our practice in the North region, so I can tell you it's very extensive training you go through. And the number one concern is the patient safety. So clinical trials don't only help the patient, they help other people, they help us learn more about the cancer, and they are definitely one of the major reasons why we are better in fighting cancer and why people are now living longer.
You'll find more about the cancer treatments available here in Lake County by visiting the website fhwatermancancer.com. Next, May is Stroke Awareness Month, and Lake County specialists say quick access to medical care can be critical for survival. According to experts, someone has a stroke every 40 seconds, so it's important to know warning signs.
So a blood clot coming from either a big blood vessel or from your heart goes into the brain and plugs a blood vessel. Once a blood vessel is plugged, then that part of the brain does not get the oxygen, does not get the nourishment, then it dies. So whatever part of the body that brain controls does not work anymore.
Dr. Sam, as he likes to be called, is a Tavares neurologist. He says it's critical for a stroke victim to get medical attention as soon as possible.
We urge them to get to the nearest emergency room to get the help they need. If you get there on time, we can do a rapid assessment of you and administer the clot busters. So what the clot buster does is it dissolves the clot in the brain, reestablishes circulation and prevent the brain from dying. The areas with less damage recover back to normal, come back to their normal function, so the body functions improve. In addition, we also give physical therapy to make the muscles strong so that the brain can function with the muscles. And sometimes they also need extensive speech therapy to reestablish their speech pattern. So, there's a lot of research to show that people who get the rehabilitation do much better than who don't.
Dr. Sam says there's an important word to remember to help quickly identify when someone may be having a stroke.
So the word to remember is FAST. The FAST stands for F for face, A for arm, S for speech, and T for time. So if somebody suddenly develops some facial drooping, then that is a sign of or potential stroke. If suddenly somebody starts having speaking difficulties, where the speech is garbled, or if they don't know what to say or the speech is not coming out, again, warning sign of a stroke. If they suddenly developed tingling, numbness, weakness on one arm or one leg on one side, then that is the sign of a stroke. So anybody who has stroke symptoms or an impending stroke should go to a certified stroke center so that they'll get the proper treatment in a defined period of time.
Heart disease is a risk factor for stroke and is why cardiac specialists encourage patients with a medical history to be aware of symptoms.
My last procedure, which was open heart surgery, was 3 years ago, and it went very well. Everything was very successful, but as the years passed by, I started to get shortness of breath again, and so my cardiologist asked me to come over here and have a heart cath, and I had that and had to have 3 stents put in.
Cynthia DeVos, a pastor in Mount Dora, was referred to a Lake County interventional cardiologist for the procedure.
The way we do is just like an IV line is inserted in the hand, we insert in the groin in the artery, which is called femoral artery, and through which we pass catheters, which are the size of a small tip of the ballpoint pen, and go all the way into the heart under the camera and insert and take the pictures of the arteries of the heart, find the blocked artery, and through the blocked artery we put a wire. On that wire we put the stent and blow it across the blockage. It has a balloon on the top of that, and the stent will be deployed and keep the artery open so it will stay there permanently.
And it was not uncomfortable at all, and Dr. K was talking to me while he was doing the heart cath and asking me how I was feeling and if I was okay. And it did not take long to have that done. And then I was in recovery, and the nurses were very, very attentive there. They took very good care of me to make sure that I think there's a possibility of clotting and all with that. I went home the following day. I had some discomfort in the groin area, but it wasn't anything that I would have to say was so painful I couldn't tolerate it.
Dr. K and DeVos agree that it's important to listen to the warning signs your body sends.
And I think that's a big thing with people. They just put things off and put things off, and I at times do that myself, but when it comes to your health, if something doesn't feel right, if something is out of the ordinary, that you should not wait. Because I waited for a long time with my heart, and I almost died.
So when they don't feel well, and if they have risk factors for the heart disease, which include family history, diabetes, high blood pressure, obesity, smoking, they better call for help to check, make sure it's not the heart.
Visit fhwatermanheart.com to learn about Florida Hospital Waterman's Chest Pain Center accreditation and to find important resources to prevent heart disease and stroke. Plus, you can take online quizzes to assess your heart health risks. It's not uncommon for a physician to prescribe home health care after a patient has had a major procedure. Lake County residents will be glad to know one local agency has received high marks for service quality from the Centers for Medicare and Medicaid Services.
The rating scales are from 1 to 5, with most agencies following middle of the road at 3 or 3.5. We scored a 4.5, so we feel like we are more than above average in the quality of patient care. They have core measures that they look at. Some of them are patient-driven and some of them are process-driven. It's a composite of maybe 24 different questions, and the patient satisfaction survey is also a part of that. All of our nurses and therapists are trained through home care and have to follow policy and procedures along with home care. We follow the same uniform structure as the hospital. We all wear ID badges. They can be very easily identified when they come up to your door. We provide skilled care in the home, skilled nursing for wound care, diabetic teaching and education, medication management, physical therapy, occupational therapy, speech therapy, medical social workers, home health aides, and pastoral care. One of the Medicare guidelines is that patient choice is what is most important. So having star ratings and the CMS Compare website available for consumers to educate themselves prior to choosing an agency will help them to receive the best quality care they have in their community.
Visit fhwaterman.com to learn more about home care services available for you and your loved ones. There's a lot more in store when Waterman Wellness returns. You'll find out how Lake Emergency Services dispatchers are able to immediately know vital information when a 911 call comes in. A Tavares pediatrician shares how she helps children with food allergies and their parents stay safe. And we'll show you how to make a quick and delicious recipe that's perfect after a workout. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this episode. First, Waterman Wellness invites you to consider attending these community events. We'll be right back.
Time for the Creation Health Tip of the Month. Don't allow differences to keep you from getting to know people. Today, step out of your comfort zone and connect with a stranger at work.
Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Melissa Hritzik. Lake County officials want residents to know about a free service that can help emergency personnel save precious time after receiving a 911 call.
What is the address of the emergency?
When Lake EMS dispatcher Ashley Tomeo answers an emergency call, she hopes the caller has registered with Smart 911.
Smart 911 is a free program that residents in Lake County can sign up for. It's done online and the information is stored in a database. When you create a Smart 911 profile, for each user profile that you have, you can upload a picture, you can upload the medications, you can upload doctor's information, phone number, pet information, the list just goes on and on.
Tomeo says having that information immediately can help with the response.
One time I had a call where the caller was really upset because her husband took a lot of medications and she couldn't think of all of them. And I assured her, I see it's on your Smart 911 profile. If that's up to date, I'll copy all that information to the paramedics so they have it. And she was very thankful that that was available to her. So when we have the situation that we are assisting the patient, if we have that Smart 911 information available, I can provide that information to the crews in the notes of the call, and that just enhances the care that the paramedics are going to give once they arrive on scene.
Tomeo says Smart 911 will send an email every 6 months to remind users to update their profile if needed. For more information about Smart 911, visit the website on your screen. An allergic reaction to food can prompt a visit to the emergency room. In our next story, a Tavares pediatrician has important information for parents.
One of the things that worries parents with children with food allergies is that their child might have an allergic reaction to a food once they get to school, particularly peanut allergy. So we have to have an action plan in place for a child that's exposed to a potential food allergen at school. Anyone that is around that child needs to have knowledge that the child is allergic, and that caretaker needs to know how to react in case that child ingests that allergen. I prescribe for the children and take a lot of time to educate them on how to use an epinephrine auto-injector. That child should have his epinephrine auto-injector with him at all times, which is a big hassle, but it's a bigger hassle if you don't have it and you ingest that allergen. When the children are at school, they're exposed to a wide variety of foods. At birthday parties, parties at people's houses, there may be foods there prepared by people that contain the allergen to which the child is allergic. The child and the parent have to be particularly inquisitive. Every food that goes in that child's mouth, the child has to know that it does not contain the allergen to which they're allergic. So we spend a lot of time telling children that, and their parents and their caretakers, because a life-threatening anaphylactic reaction can occur within minutes of ingestion of that allergen.
You can find an expert to help you and your family assess whether you have food allergies by visiting the website on your screen. Sometimes it can be difficult to whip up meals that are nutritious and easy to make when you're always on the go. Next, we visit the Con Recreation Health Center kitchen, where you'll meet our new nutrition team, and they have a healthy option for you. So if you're like most of us, you're always on the run, but instead of relying on drive-thrus, how about staying on the route to wellness? Today I'm here with Florida Hospital Waterman Executive Chef Tom Sewell and Nutrition Specialist Ellen Boyer. So Ellen, would you like to tell us a little bit about what we're making today?
We're making an apple pie smoothie, which it has some fruit, some nuts, and then it also has some soy milk and some spices. And it's a great recipe if you're on the go, and it will give you some extra carbohydrate sources that are also good for working out as a post-workout shake, and it helps restore muscle glycogen after a workout.
Okay, sounds good. So Tom, do you want to show us how to get started?
Yes. What we have in our smoothie is an apple, a banana, cinnamon, nutmeg, almonds, vanilla soy milk, and some ice cubes. So first we're just going to take the apple. We're just going to take the core out, which is very simple. So all you do is just cut from each side. Okay, you don't need anything special for it. What's great about this recipe too is that it's familiar flavors. So most people like apple pie. So it's something that you can easily make for someone that's never had a smoothie before. So they can definitely, they'll know the flavor. So you're just gonna put the apples in there, okay?
Now if I wanted to substitute a different fruit, is that possible?
Yes, you can substitute anything you like. You can do a pear, you can do mangoes, you could actually put spinach, you could do really anything you want with the smoothie, which is great. This is really good. Then just take the banana, just peel it, a couple of cuts in there, okay?
And the apples and the bananas and any fruit that you use will also provide a lot of fiber, which is beneficial.
And then we got some almonds, okay? We have the vanilla soy milk. And then we have cinnamon and nutmeg, which everyone knows is really great with apples. Okay, and then I'm just gonna put some ice. See how simple this is? You blend it for, let's say, about 30 seconds until it gets nice and smooth.
It's quick.
Yep. Turn it on. Personally, I like my smoothies really smooth, but if you like it chunky, I'll do it for less. And just take it. Pour it.
Nice and easy.
Nice and easy and healthy, and anyone can do that.
Perfect. Thank you, Tom.
Thank you.
If you'd like to try this delicious apple pie smoothie recipe, visit watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the June episode right here on Lake Sumter TV for some of these stories and more. Local experts share important information about how to detect prostate cancer. And we'll go back to the Con Recreation Health Center kitchen to learn about brain food you can serve to your family. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Alyssa Hritzik for the award-winning Waterman Wellness.